From the heart of Carroll County government, I'm Commissioner Ed Rothstein, and you're plugged into Conduit Street Podcast, the place to learn more about policies affecting local government in Maryland.
Hello, and welcome to the Conduit Street Podcast. This is Sarah Sample bringing the show to you this week as I step in for our regular hosts, Michael Sanderson and Kevin Canale. As member of the policy team here at the Maryland Association of Counties, I am the liaison for county human service agencies, and this gives me the distinct honor of working with state and local leaders on policy and services specific to aging and the elder populations in Maryland. Today, I will be joined by not one, but two storied leaders working in the space at both the local and state level. They will join me to dive into the who, what, when, where, and how of services for aging populations in Maryland and their families. So, first, I have with me today a member of the Governor's Cabinet, the Secretary of the Maryland Department of Aging, Carmel Roques. Secretary Roques has dedicated her career to improving the lives of older adults and their families, and is now putting that experience to work as the leader of the state agency. Also joining us for this conversation is Heang, who is the current director of the Baltimore City Area Agency on Aging and current Deputy Health Commissioner for the Division of Aging and Care Services in the Baltimore City Health Department, and was recently appointed as the Baltimore County Director of the Area Agency on Aging. So welcome to you both, and thank you for joining me.
It's a pleasure to be here, Sarah. Thank you.
Yes, thank you. It's so much. And Sarah, that was quite the mouthful. Area agencies and aging. I'm very impressed.
I know. Well, sometimes we just say AAAs, right?
Yeah.
Right.
Yes.
Yeah. Well, thank you both for joining me. I appreciate you making some time. I know that it's tricky sometimes between the Thanksgiving holiday that many people celebrate and then the December, Christmas holiday. But I know that it's a really, really busy time. So we appreciate that. So before we dive into all the moving pieces around local and state agencies that deal with aging-related services, why don't you tell us a little bit about what brought you both to this work? So I'll start with you, Secretary. What motivates you to do this work for residents?
Well, this actually started a long time ago for me. When I was a graduate student at the University of Chicago, I had the privilege of being involved in a research project that was ongoing in a local nursing home. And it was during that research protocol that I really first became deeply engaged working with older people and their care providers, and really found my passion place. And so my career went on then to involve working mostly in the private, not-for-profit sector, at all levels, really, from being a direct care provider as a licensed clinical social worker, to developing programs, to overseeing programs, to then being able to actually be chief operating officer and CEO of larger healthcare systems. And so all of my work really has been, I'm very fortunate in that my life's work is really, very connected to my passion and to my beliefs about the, worth and dignity of all people, and my absolute joy working with people as they are aging and older adults late in life. And it's, I think there's been such a huge benefit for me in that I've been able to work in this sector at many, many different levels, so that when the opportunity came to serve with this particular administration under the leadership of Governor Moore, I really felt that I had an opportunity to take all of the work of all of the years of my career and be able to focus at a state level around policy and about really reshaping and redesigning in many ways the approaches that we take to serving older people in Maryland. And so it's a really wonderful opportunity for me personally in terms of my life's passion, my life's work. But I also think that it's greatly advantageous to the state to have a person overseeing the Department on Aging who has had so much experience in the field.
Oh, yeah. Absolutely. And the one thing that you touch on that I think is so important, especially when we talk about public policy, is just sort of the passion that you bring to it. And I think particularly in, something to do like with aging and elder populations and feeling vulnerable and needing care, I think that passion coming through in sort of this type of work, I think really does ultimately lead to better outcomes and more thoughtful policies. So I think I'm very grateful that we have someone with so much passion that is leading a division like this.
Thank you. I agree. And it makes every day, even though sometimes the work is very hard and daunting, it makes every day a joy.
Oh, well, thank you for doing it. And how about you, Yang? What brought you to this work?
I think similarly, it started with, this field and this work is deeply personal to me. I think intentionally, I never thought I would be in the field of aging, but I think the trajectory just went there because when I first came to this country as a refugee, my parents had to work and go to school. And so I was raised by my grandparents up until I was 11. And so when it was their turn to age in place, my grandmother had Alzheimer's actually for about she survived it for about 15 years. And so she was able to age in place at home because we had so many family caregivers. And so there was no question when my grandparents became ill and had to age in place that I would be their family caregiver. And so it started kind of on a personal level of just caregiving from one side to another. And then in my career after college, I started. First of all, I grew up in Connecticut, so I was going to either work in insurance or be in human services in some way. And so I had volunteered in this refugee and immigrant organization, and there were a lot of older Cambodian refugees who really, I just saw the impact on health when they didn't have access to care. And I started working and just connecting them to resources and became a community health worker. I relearned the language in Cambodian, and I just learned how difficult it was to navigate just simple things when you don't know the language, when you really don't understand the different systems in play, especially for government access. And so it was like the best experience just working directly with older adults in that space. And then the trajectory went into communications and policy, and now in government providing direct services and access to care on a local level. So that's kind of where my career started. It was something that I never thought I would do, but I found myself really wanting to help people and really understanding what it means to be relying on other people for care and what that means and what older adults actually contribute to the communities they live in, because there is a lot of contribution that they provide and still provide.
Absolutely. Well, and one thing that you touched on that resonates with me is that, you sort of explain your experience as having been there and sort of seen the perspective from being a caregiver for an elder individual, but then also seeing what an older individual is going through personally in terms of navigating some of these challenges that they'll start to experience as they do age. And so I think that experience lends itself to even more trust in terms of the communities that we're trying to help, because you've been there and you've seen these things and you sort of have a good perspective on what they might be going through and what those challenges are. So I think that just lends itself to the work even more.
And I will say that every person's journey is different. It's a personal journey. And I think as we'll talk a little bit more, our role as an area agency in aging is to really meet them where they are on that journey and to provide that support.
Definitely. All right. Well, then in terms of sort of meeting them where they are, as far as Maryland goes, when it comes to an aging population, what is our ecosystem like generally in terms of the older communities? Are there trends that, so to speak, that you see amongst older residents?
So, Sarah, this is one of the things that I focus on continually, both internally in the agency, but across state government. So with my colleagues in as cabinet secretaries and also with the broader aging service network. What we talk about at the state unit on aging level and the framework that we're bringing to the state of Maryland is that of the lens of longevity. And longevity just means longer lives. It's a measure. It's a demographic measure. And the reality of Maryland is, and of the country and actually of the world, is that we are older. We are an aging society. And, all the baby boomers, I'm in that generation, will be older than 65 in 5 years. That is the largest cohort that's been born in this country, the baby boom cohort that was born right after World War II.
Yeah.
And, all of our society shaped around us. So the schools, the hospitals, the university system, everything was shaped around this very large cohort of people who are now 65 and older. And so a quarter of our population here in Maryland will be over the age of 60 in a couple of years.
Oh, wow.
People, it's hard to for a lot of us to even register that.
Mm-hmm.
And a lot of times when we're talking about older people in Maryland, what we begin to focus on really are people who are frail, chronically ill, perhaps poor, having outlived their resources or having always been marginalized, socially isolated, not having purpose in their lives. And we forget that there are 1.4 million people over the age of 60 in Maryland, and they aren't all in that group. That's some of them. And that is a group of people that is part of that population that we're responsible for finding best and highest use of state resources to serve them. But for me, there is a broader conversation, which is, what does it mean to live in a state and in a society where a quarter of the population is over the age of 60? And where a third of the working population is over the age of 50, and where in the next 10 years, there will be more people over the age of 60 than under the age of 18. This is a demographic reality. And when under this administration and when I became secretary, one of the things that I committed to was not just focusing on what is best and highest use of resources to serve people who, in fact, are currently older and are not healthy, don't have the financial resources they need, not socially connected, and living lives where they do not feel they have purpose and worth. Besides that, what are we going to do to change the way we work and think about older people so that we don't just keep growing an ever larger population of people who fit that profile?
Absolutely.
And instead, we're able to begin to do things that mean that we have a society where older people, we have a much more complete and inclusive view of older people in our society and their role. And I know we're going to talk about that more as we go on. But the demographic trends really are that we are an aging society.
Yeah.
And we are an older society already.
Well,
and that's going to become even more so.
Absolutely. And I like the point that you make about how people often focus on the services for individuals who are in need of something specific to medical care or transportation and things like that, and not as much how to improve just sort of the lifestyle of individuals who are aging and getting them feeling like they're, connected to their communities and so on. And so I think about when you look at it from that lens, if you're able to do that lifestyle piece where you can enhance their the feeling that they have in their community, that can also lead to better health outcomes. built
Oh,
on.
it absolutely does. The research that's out now says that if you are ageist against yourself,
Oh,
if you think negatively about being older, it cuts your life expectancy.
exactly. Yeah, it's
Some,
amazing.
some say as much by 7 years. It
Wow.
is actually it actually impacts how long you will live if you think that being an older person is a catastrophe,
Wow.
which is how, in many ways, our society views it. I mean, we can, you know, talk about ageism maybe later, but that's another piece of what I really wanted to be very clear about
Definitely.
in my time as secretary, which is we must purposefully, intentionally, and publicly combat ageism.
Well,
Call
so
it out.
absolutely. Well, so, and then like, let's talk a little bit about what that means then in terms of practice, so locally and at the state agencies. So I guess, so from a county perspective, we know each county has an area agency on aging.
Mhm.
I think, from a funding perspective, some funding is appropriated by local governments, but also from the state for these divisions. I think for us, the amount can depend on the size and the scope of the work that the local agency is
Right.
responsible for. Like, for instance, I know some of the smaller jurisdictions, the local budget contributions are in the lower millions, sometimes upper thousands. But then larger jurisdictions like Howard County, I think is an example, they're in the tens of millions. So
Mhm.
it's an important role, our county governments are playing from a funding perspective. But maybe let's start to talk a little bit more about what are some of those divisions doing locally when it comes either to services specific to someone needing a specific type of tangible care, or some of the lifestyle building stuff that you've been talking about? Like, what's that local role look like day to day?
Hyung, do you want to talk about that a little bit and how that plays out?
Sure, I can talk a little bit about our area agency on aging in Baltimore City. So Sarah, as you mentioned, I've been in this role at the city for about almost 9 years, and I'm going to transition into a different role in the county, in Baltimore County, to oversee their area agency on aging. And really, we are the local coordinating agency for aging services. We work very closely with our state unit on aging, in which the secretary oversees through the Maryland Department of Aging. You discussed a little bit about funding. So every local jurisdiction is different in terms of how their funding system works. But what makes an area agency on aging is that we receive Older Americans Act funding and state funding from the state unit on aging to deliver services. I can talk a little bit more about the services, but that's what makes an area agency on aging. There are 19 here in Maryland. There are about 600 across the country, and they're all in different forms of local governments or nonprofits. They're very interesting, but what unites us is that we have a core mission of coordinating aging services for older adults age 60 and over. We provide direct services, advocacy, connect access to services. Our area agency in the city is unique because we're housed in the local health department. And so we have both a public health and aging lens around how we provide services. There's a lot of public health focus in a lot of the services we provide, particularly in our brain health work. We're really focused on overdose and supporting older adults that might have substance use disorders. And so it really depends in terms of the priority of what the local government need is. And so in the city, the needs in the city are much different than what the needs might be in other counties.
Absolutely.
Our funding is different. It's structured differently. And I think you hit it right on the nail in terms of like local jurisdictions contribution. There is a contribution match if you are receiving Older Americans Act funding. It's very nuanced in terms of how that funding works. I think a lot of people think that we have a lot of flexibility to provide and meet the needs of our local government. And I think you had asked a little bit about challenges. And so that's kind of touching upon that a little bit, is that there is such a broad need of services that we're really defined on what our ability to provide services based on funding.
Right.
I'd like to build on that a little bit, because I do think that as Heang was pointing out, that there's, people think that, well, they know maybe what their area agency on aging does, and they think then that's what they all do. And, we laugh and we say, you've seen one, well, then you've seen one.
We say that a lot at the county.
There's huge variety
Yeah.
across the state. And that's actually intentional, so that there is more local control. But I want to talk more broadly about the state unit on aging, its relationship to the county level area agencies on aging, and then the funding piece of it, because it does play out very differently in different ways. But the funding, so in Maryland, the Secretary on Aging oversees a cabinet level agency. That is not true across all of the country. Not all states have a cabinet level agency that is dedicated to all things having to do with older people. So in Maryland, we're very fortunate because of that. So the state unit is designated by the state has to say, this is going to be our state unit that we've designated to our federal funder. And our federal funder is the Administration for Community Living. And the Administration for Community Living is responsible for the way the funding for the Older Americans Act gets distributed to the states. So there's federal funds that come to every state and to Maryland from the Administration on Community Living. And this is where I think we're all looking for ways we can improve the system, because the money comes in very siloed, programmatic tranches.
Yes.
And it must be spent in certain ways for certain things. Overarching, the federal funding through the Older Americans Act and the recently updated guidelines from the Administration on Community Living, it is to be targeted to those with greatest need. So it isn't like funding comes down and it's just like, well, here's your money, do whatever you'd like with it. It's very specific. Okay. Yeah. So the state unit on aging gets the funding, and then we have a formula and it gets distributed to the local agencies.
Got it.
I think people may think there's a whole lot more money than there actually is that comes specifically to care for older people.
Yeah.
So our federal funding that we were able to distribute out to our area agency network in the current fiscal year was only $44 million. $44 million is like a rounding error.
And then you divide that up amongst, 24 jurisdictions.
Yeah. Right. So I raise that not so that we can, go, oh, woe is me, but just so folks will understand that's limited. And then the state has $36 million, which we distributed to the area agencies on aging. And all of the rest of the work that they do, their funding has to come from local county governments or from private sources. And so really, we're a funder for our local area agencies on aging, which are required to be designated through the Older Americans Act. But we're not, in some cases, we're certainly not their single funder.
Yeah.
And we may not even be their greatest funder. And so that's an issue that we need to sort of think about in terms of what is the overall funding available for persons who are over the age of 60 in greatest need in our state. That's one sort of responsibility that by statute, our agency has, which is we are to receive and distribute federal and state funding to highest and best use for those in greatest need.
Got it. Well, so one thing you touched on, you said the money is very siloed and it has very particular uses. And one of the things that I have found just in the policy areas that I work in is that um, it's a little bit more difficult, but we definitely have to do it at a county level just because of, some of our budget constraints. But when we have different agencies locally that have sort of a shared mission, so one example would be sort of we've got the local health departments who work a lot on public health issues. And then we have detention centers who are caring for individuals who are in our facilities. Oftentimes, when there are certain restraints financially, because there's a shared mission there, they're able to sort of pool funding across agencies to sort of reach an overall goal. So for one example, in the detention centers is medication assisted treatment. And so you've got the detention centers collaborating with their local health departments on making sure that these services are provided locally. I mean, do you think, is that a possibility in terms of getting some of the funding to go a little bit further in terms of like maybe cross-agency collaborations where you can leverage both types of money?
I'll let Heang talk about it at the county level, but I'll talk to you a little bit about it at the state level.
Yeah, go
so
ahead.
You just identified exactly the strategy that this administration uses, not just for serving older people, but also, all of the benefits and services that we want to come to our residents of Maryland. So we call that braiding funding.
Yeah.
Don't you just love it? Everything has a little term that goes
I
with
do.
it. So what we're doing as a state agency is that we're taking the all of government approach. And that's something Governor Moore is very much a champion of as an approach. And what we're saying is, okay, if we have some funding in a local area, that the good example is, I think, with the Enough model. So Enough model is targeted toward those communities that have children living in poverty at 10% or above of the children in that jurisdiction. And so if there's going to be enough funding coming into that community, then there probably also we're going to be having funding that's coming into that community around housing supports and services. And the Department on Aging is going to likely be having funding that would flow into those families to support the older adult in those communities.
Right.
And one of the things that we know is that in situations where there are children living in poverty, very frequently those children are living with their grandparents.
Yeah.
And so that's a place where the focus may originally be, let's say, on the children living in a family, but there are other members of the family that can receive benefits that are coming from other state agencies and supports. And we're looking to do that in as many ways as we can. So on the housing with services side, the Department on Aging is not, building affordable housing for older people. That's the Department of Housing and Community Services. Mm-hmm. However, what we're doing is trying to provide wraparound services and the kinds of supports to family caregivers that means that older person can stay housed. And so we're very engaged specifically right now in the work that has to do with unhoused people over the age of 60 and making sure that they get into transitional housing and then into permanent housing. Because, when you start to take a longevity lens and look at, let's say in this case, the population of people who are unhoused in Maryland, we call these people homeless. Once they sliced and diced the data, they had never before looked at anybody over the age of 60. And it turned out that's the fastest growing population of unhoused people in the state.
That's interesting. It adds so much to the story when they drill down a little deeper into those numbers.
And start to say, okay, wait a minute. Why did we just cut it off at 50 and stop talking about? Yeah. And what do we know about those people becoming unhoused? Well, they're becoming unhoused because they've had a health crisis or because their housing has become unaffordable. Right. They're renting and the rents have, gone up, or they're living on a fixed income and They can't afford their housing anymore. So I kind of digressed, but what I'm trying to point out is that there are so many opportunities to take a multi-agency approach, an all-of-government approach, a multi-sector approach to serving older people with the benefits that and the funding that we have available.
Yeah.
So, Heang, I don't know if you want to add to that in some way.
I think, Secretary, you've really laid out the funding kind of streams and mechanism and challenges that we have in terms of providing services to older adults. It's very specific, but the needs of local government is different all across. And I think one of the things that the Secretary and under her leadership and the department has been able to do really, really well is looking at their funding streams and giving local agencies or local governments the most flexibility to do what they need to do to meet the needs of their communities. And so we really appreciate that. And it takes a lot of just really understanding the regulations and understanding what you can change and not change. One of the greatest things that happened for us at senior care, which is an in-home care stopgap services for those who are waiting to get into the Medicaid home and community-based waiver program. The Maryland Department of Aging used its funding to give us the most flexibility between two funding streams so that we can meet the needs of the clients that we serve. And so there's little things that we can do to essentially, with the little funding that we have, to expand our reach. And I think flexibility at the local level is the most important because the needs across every jurisdiction is different. As I'm looking at my transition here in the city, the needs of older adults are basic needs: housing, food access. As I look to prepare to run the area agency on aging in the county, I think the needs are different. And I think transportation and reaching out rural communities are going to be something very different. And so we really need the flexibility and the funding to be able to meet the needs of that.
Yeah, absolutely. And what I would add too is, you both mentioned sort of the funding and sort of the cross-agency collaboration, but also that flexibility piece. It really helps us speak to the needs locally because the communities are all a little bit different. And I think when we're able to do that, the actual spending is more efficient because it's closer to the need and understanding what a particular climate is around aging in a particular area.
Right, which also kind of just brings us to kind of our roles as an area agency in aging, and what we rely on as a state unit is the advocacy piece, is really pushing that message out of what we need to be able to deliver services on the local level. And that's what the state has done such a wonderful job in doing, and particularly around the pandemic. We were really restrained by Older Americans Act funding, but with the pandemic, we needed to make shifts in our food delivery services really quickly.
Oh, yeah.
And so we saw that change, but that was due to all the advocacy that was done, both at the state and federal level.
Yeah. Well, so, one thing I wanted to start to touch on is something that I've heard from Secretary, your team a good bit, is Longevity Ready Maryland. So we've talked a little bit about the funding that goes into this these types of services for aging individuals, but let's talk a little bit about I know there are challenges there, but what is your vision moving forward in terms of what are those major priorities to resolve some of this stuff, even with the financial constraints?
So I am always aware that when we talk about being longevity ready, a lot of people can't quite understand what we're talking about, and so I want to I want to make it seem as straightforward as possible because it actually is. What we're talking about when we talk about being longevity ready Maryland is simply saying we recognize that Maryland is a state that is aging rapidly, that the sort of the demographic phenomenon that I talked about earlier on.
Quarter of the population, I think.
It's here. Right? It's here. And we recognize that all of the ways that we have thought about the role of older people in our society And all of our programs and services and policies and the models that we use for funding and decision making about serving older people are really based on last century, when the population didn't look like it does now.
Yeah.
And so recognizing that as a state agency, given that by statute, we are required to plan, to advocate, to formulate policy and legislation to serve older people in Maryland, we said, well, the first thing we need to do is just take a good look at the fact that we have a mismatch right now.
Absolutely.
Between the population and in a very inclusive view of the population, which includes in Maryland a highly educated, fairly financially secure, working older population, as well as an increasing population of folks that are marginalized and disenfranchised. So we looked at that and we said, what can we do as the state agency? And we said, well, there's some really big things we should work on. We set that in place in terms of 4 goals. One is building the longevity ecosystem. A lot of what we were just talking about, supporting, building, improving that.
The wraparound elements.
Right. Promoting economic opportunity for all older people. Preparing Marylanders to be able to afford the fact that we are now living longer than we used to, and that our models don't fit with the fact that we might live an extra 30 years after quote unquote retirement.
Right.
So there's a whole disconnect there. And we want to prepare older people in Maryland to be able to optimize their health and wellness. And this is, that's where there's massive opportunity around evidence-based programming for managing and preventing chronic illness. I won't go into all the details there, but there's lots to be done.
Well, that can be a big challenge in Maryland in particular, because, Maryland, from a healthcare standpoint, our ecosystem is a little bit tricky, I would say, in terms of, I've seen some numbers that basically show that we don't have enough actual doctors for the need in our state. And then we've got situations with the hospital where our wait times are like 40th or 49th in the country. So we're already not in the best ecosystem when it comes to preparing to optimize your health.
Yeah, we're challenged. And it's not, just, I won't say that we're the only ones. This is an issue across the country right now, in that there are not enough medical and healthcare providers at any level to care for this burgeoning population. So we broke down, well, what are our sort of things we think we can work on right now? We want to modernize and redesign our outdated state-funded long-term care services and supports. So that's the sort of the funding that I said flows in from the state to the local area agencies on aging. It comes out in buckets of money, and we really want to look at that. And to Heang's point, we want to find ways that we can make sure that we've designed the funding system so that it really maximizes best and highest use of those resources.
Exactly. So that it can speak to that, the actual needs. Because sometimes
and we have some legislation we're proposing around that.
Absolutely. So we'll get into legislation here. But sometimes when the need and the resources don't line up, you end up with resources being spread too thin, and then the actual outcomes are weakened because of that.
And in the case of some of that funding, because it can only be spent on in very specific ways, if the local agency can't actually use it in that way, I'll give you an example. If the funding can only be used to support paying for services for people living in affordable senior housing, and you don't have more than 1 or 2 of those affordable senior housing campuses in your county, you may not be able to spend all the money that's been given to you for that need because it's not allowed to use for anything else.
And then it's at risk of reverting back.
Yes. So that's the kind of thing when I talk about redesigning, that's what we're doing.
Yeah.
We also want to, and we've been working on this and we're going to continue to work on this. We have a big push to try and identify and secure philanthropic support.
Definitely.
For some of our initiatives. And we've been working closely with the Maryland Philanthropy Network, but this administration also has set up a framework for innovation and partnership and working with some of the bigger national funders. And our department is starting to move through that process and try to secure philanthropic funds that give us more flexibility and, allow us to do things that maybe we don't have other funding for. We're also going to really continue this all of government approach, this cross agency approach to serving older people. And in particular, when it comes to keeping older people housed safely and securely. And so we're working with the Department of Health and the Department of Housing and Community Development and the Department of Disability on two very specific programs. One that has assistance in community integration services and one that's called the Capable Program. Both of those are about delivering support in the home to an older person to make it possible for them to stay there safely and securely. And then we're working on the National Family Caregiver Strategy. So we went out and secured some additional funding that we can use to support the Caregiver Commission in Maryland and all of the work that needs to be done to actually begin to identify what is needed specifically to support family care across the full life course. Family care doesn't just happen, when you have older adults that need care. Family care happens when you have children that need care, or you have disabled people in your family that need care. And so the National Family Caregiver Strategy recognizes that right now, a huge element of the national long-term care services and support system is that there will be family care. And, Heang referenced that, where her grandparents cared for her.
Absolutely.
This is happening all across the country. There's this huge reciprocity that occurs where older people are taking care of younger people in the family, and then younger people are taking care of the older people in the family. And it happens across the full family life course. It isn't just like an episodic thing. And we want to find the ways that we can best enhance what's available to support family caregivers, but also there's some major policy changes that need to happen.
Absolutely.
So that people who provide family care aren't discriminated against in the sense that if you drop out of the workforce, getting back in can be very difficult. You lose the ability to save money while you're not working. You lose the ability to progress in your career, and you don't ever make that up. And what we've discovered is that in particular, women who give family care and step out of the workforce to do that never recover financially.
The comptroller mentioned that. I remember in a speech that she'd given, I want to say about a year ago, that how big of an issue that was.
Right. So that's a great example where we have our comptroller who's taking a longevity lens and paying attention to that and saying, when it actually comes to thinking about working families and most people who give family care also work full time.
Yep.
It's like learning about that and working on that. So that's another thing that we're really wanting to do. Definitely. And then launching the Longevity Ready Maryland. It's It's a big, big effort.
Yeah, there's a lot going on. Well, and one thing that you mentioned, so I really appreciate what you mentioned about philanthropic funding, because that's something that has come up with our local management boards. It's come up with our health departments, and that's something that I think from a state and local level, I think all the teams could sort of do well to start to focus on how we can leverage those dollars a little bit more. Because I know, especially with our local health departments, that was something that we just discussed in our meeting last month, just about that being something that is not. It's not a resource that is tapped into as much as it probably should be, I think, from a state and local level. So I'm happy to hear that you're thinking about that as well. But so you mentioned it earlier, session, it's right around the corner. Even when I say it, I get a little bit of a twitch in my eye. I'm ready though. So talk to me a little bit about your plans for session. Are you going to be doing any committee or subcommittee briefings to ground legislators on some of the things that we're talking about, bills that you're proposing, things like that?
Yeah. So you know how it works, Sarah.
Oh, yeah.
I can't really specifically talk about the bills themselves until, that's all been signed, sealed, and delivered to the legislature. But I can tell you what we're working on more generally, and also how we've been sort of socializing our legislative package, and also just generally working to develop strong collaborative relationships with the state legislature. So one of the things that I know has been talked about, and it's not unique to the Department on Aging, but there's been just kind of a sea change in the way the state agencies relate to the legislature under this administration. And there's a very sort of collaborative approach.
That's what we've been hearing.
And it feels really good, I think, on both sides. So part of what we've been doing outside of session is meeting with, the heads of some of the committees that oversee our work, and just spending time talking with them about what's important to them, what's important to us, and sort of developing that basic trust, so that we can work through the hard work of making, policy and law.
And that goes a long way, because sometimes it's just that, they're so busy and they've got jobs outside of working, in the legislature, and even party leadership. They've got a lot that they're doing in the interim. They're not just going back to work and then coming back, when session starts. And so it's just having that ongoing conversation and collaboration, I think, helps everyone focus on what are the real issues and how can we actually solve some of them effectively as we get into session. I think sometimes people are working in their corners and their silos, and just it ends up turning into a situation where we're spinning our wheels a little bit. And so I think that certainly is something that I've seen on our end in terms of working with legislators and different agencies, is that being on the same page it's making a big benefit in terms of when we get to testimony or a hearing, we can show that we're all on the same page. We worked out our differences. There's still a few things here and there. And I think that saves a lot of time and a lot of energy, and for the better.
So we are planning to brief the House Health Government Operations Committee.
Okay.
And there are some other opportunities that have also come up. So that's one of the things that our legislative director, Andrea Nunes, has been sort of structuring for us.
Definitely.
And we also have been working to kind of help our legislative partners understand what we're doing, for instance, with our dashboard, and with the emphasis on being able to really have data that helps them have a more comprehensive picture.
Absolutely. And it gives you more agility in terms of what needs to happen.
Right. So that's another piece that we're working on. We're going to be having some town halls in the late spring, where we'll be getting public comment back on our longevity ready plan. And so those are some of the things that we're working on. And in terms of legislation, so we are working, as I said before, to modernize our state funded programs. And we have 3 programs that we're looking to find ways that we can have more flexibility in the way the funding is used. So they're still under consideration by the Senate and the House presiding officers, so I can't really go into a whole lot of detail about that. But the concept is that we take the funding that is right now distributed into three very distinct programs and combine it so that then we can develop the programmatic aspects with our local area agencies on aging. We can develop the program so that they can use those funds much more flexibly.
Yeah.
And the first people we talked to about it was our area agency on aging staff. And so we held some work groups and they came up with recommendations, and that's been used to really create the legislation that we're proposing around that.
Great.
We have a second bill that we're proposing, which is really also to be able to modernize our senior call check program. And that was a program that the funding comes from the Universal Service Trust Fund, which is part of the Department of Disabilities. So we've worked really closely with Secretary Beatty and her team to really identify what are the things that we can do with senior call check, which was really designed originally to be an automated call that goes to an older person's home to ensure that they are safe. It's a safety check, a health safety check. So the issue was related to the fact that older people who fall in their homes, it's one of the leading causes of hospitalization and one of the leading causes of death among older people. And so the senior call check program was developed using funding through the Universal Service Trust Fund. And what we're doing is expanding that to have the more of a social isolation prevention emphasis. And so there are ways that we can do that, but we have to change some of the wording in the statute to be able to make that happen.
Got it. Well, that seems like that could make a big difference.
And we think it will. Mm-hmm. So basically the legislation we're proposing at this point really has to do with our redesign and modernizing existing programs for best and highest use of the funding that is currently available.
And one of the things that you mentioned, I think, is actually something that we're hearing across a lot of different issue areas, is just trying to get some of the funding to be a little bit easier to use, just adding a little bit more flexibility to it. And I think that's particularly prudent right now because of obviously the state budget outlook is pretty dire. And it's not just the state managing their own budget, it's the revenue growth that affects revenue locally and at the state level being fairly weak. And so I think, that flexibility in terms of how funding can be used is something that I think legislators are probably going to be hearing a lot about from a lot of different policy areas and agencies, for sure.
It's one of those things, and Heang can probably speak to this, the challenge of this at the local level, but in an interesting way, the fact that we are facing a time of fiscal constraint, and that we do have to make some hard choices, it actually, and I say this because I'm very proud of the state of Maryland and of our cabinet and of our leadership from our governor and our lieutenant governor. What we see across all of state government are people being really innovative. And really working across, state agencies and funding streams to try and, to your point, Sarah, make the most flexible, appropriate funding sources available. And because we don't have more money. So we have to take the money we have and really make it work for, our constituents.
Absolutely. Particularly because fiscal pressures can create more desperation and more suffering. And that is certainly something that residents are affected by. So So yeah, no, I think that outlook it's a little scary, but I think it's hopeful. Like what you mentioned about sort of ingenuity and sort of being resourceful. I mean, we see that on the local level a lot. I was writing about a project yesterday that was happening in Prince George's County, and to the point that you made earlier, in terms of braiding funding, they were braiding together, I want to say like 8 different funding sources. So sort of that resourcefulness that has to come with this, I think it's exciting because I think new ideas can come out of that too.
I do too.
Cool.
Yeah, I think that's a really great perspective around the fiscal climate that we're going to enter into and preparing to. Also, it creates an environment where decisions are made easily, in the fact that we prioritize what we need to prioritize, and so and we have to innovate and be able to use what we have. It's I just want to echo what the secretary said about that, and really working collaboratively across agencies, and really, as we prepare for session, at the local level, we really look to the state entities to really lead the way during sessions, but local governments actually play a really important role as well. If there is an ability to advocate at the local government, we have an administration and a mayor that really is supportive of making sure that our voices for older adults are heard. We have a very active Commission on Aging that supports and provides testimony around legislation. And so they're very active at the General Assembly, and we're really looking forward to this session and really looking forward to the Secretary's leadership in making those changes if possible. But changes start with conversations 6 months ago. It's just not.
Definitely.
Yeah. So really appreciate the conversation that the State Union on Aging had with local government and asking us what would be the most helpful. And I'm really excited about the
That's wonderful. Well, I think that's a great note to sort of close out on. And so, I mean, obviously, the issue of aging touches absolutely everyone in the state directly at some point, and certainly through the experience of families and communities. In, like we've talked about, counties in the state play an important role in service delivery. And as for us, as the advocacy arm of the local governments, we are excited to be a part of that policy conversation around these issues, particularly because of the wraparound nature of the services that are needed, because we do touch a lot of different things locally. So I would just like to thank you both so much for your leadership. And we really look forward to continuing the conversation and the collaboration.
Thank you, Sarah. I'm really looking forward to continuing to work with you and MACo as we go forward. It's been really great to see this relationship starting to bloom. So Definitely. Thank you.
All right. And so, as always, listeners, we hope you enjoyed another episode of the Conduit Street Podcast. And if you did, make sure to subscribe to our channel on your favorite podcast listening platform. And while you're there, give us a review, offer a like or a share, and if you're up for it, give the gift of local public policy for the holiday season. Now, for Secretary Roques and Heang, I am Sarah Sample, signing off for today, and we will talk to you soon.